Orthotropics and orthognathic surgery. It's often asked to me if we can't get a change with orthotropics in adults, should we then have surgery? And often I would agree. We are getting better at moving the maxilla up and forwards in adults, but there's still some work to be done. And although this is effectively treating the symptoms, it's affecting what's happened, it's achieving something that's very, very difficult to achieve without surgery. Gaining an impaction of the maxilla is incredibly difficult for most people to do. It can only really be achieved by changing your tongue posture to get the tongue up onto the roof of the mouth, onto the palate on a near continuous basis. And over time, and some time, that will change the maxillary position. And sometimes I think it's a very valid concept to move the maxilla up and forwards. Although it is treating one of the symptoms, sometimes by doing that, you can have a massive impact on the posture. There's an old adage in orthodontics that structure and form and function follow each other. And it's very true. Of course, I'm more interested in posture than function, but posture and function are linked intrinsically. They are completely together. So once you've changed the function, you're more likely and able to change the posture. Now, moving the maxilla up and forwards can instantly change the whole facial height. It can bring the lips together so it's easier to maintain a lip seal. It can provide more space for the tongue, so the tongue has more vertical space and can move up out of the airway and allow you to normalize your general body posture. All of these can be very beneficial effects as long as the surgery is in the same direction and with the same goals as I would normally want from orthotropic treatment. And that's not always the case, so that needs to be checked. And B, that having had the surgery, every attempt is made to change the underlying causes, because they still exist, they're still there, and surgery relapses at a far greater rate than even most surgeons would like to admit. So, fine to treat the symptoms. Usually I would recommend a maxillary impaction and an advancement. But don't forget the causes, because in medicine it's about treating causes.